BCEN Test Prep Exam Book. Question 1. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. Question 2. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A. Anticholinergics. Option B. Sympathomimetics. Option C. Cholinergics, organophosphates. Option D. Opioids. The correct answer is option C. Cholinergics, organophosphates. Question 3. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A. Atrial flutter. Option B. Prolonged QT interval. Option C. Osborne, J. wave. Option D. ST depression. The correct answer is option C. Osborne, J. wave. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Priapism is a urological emergency characterized by option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. A scrotal edema. The correct answer is option A. Painful, prolonged erection. Question 5. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A. Tachycardia. Option B. Narrowed pulse pressure. Option C. Hypotension. Option D. Tachypnea. The correct answer is option C. Hypotension. Question 6. Murphy's sign is used to assess for option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Question 7. A positive Koenig's sign is suggestive of option A. A cerebral aneurysm. Option B. Subdural hematoma. Option C. Meningeal irritation. Option D. Cerebellar stroke. The correct answer is option C. Meningeal irritation. Question 8. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. Hepatitis A is primarily transmitted via option A. Blood and body fluids. Option B. Fecal-oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is option B. Fecal-oral route. Question 10. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. U.S. citizens only. Option D. Patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. Question 11. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 12. The purpose of administering surfactant to a patient with ARDS is to: option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 13. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A. A ventricular septal rupture. Option B. Papillary muscle rupture with mitral regurgitation. Option C. Pericarditis. Option D. Aortic dissection. The correct answer is option B. Papillary muscle rupture with mitral regurgitation. Question 14. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. A dry skin and absent bowel sounds. Option C. Hyperreflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is option C. Hyperreflexia, clonus, and agitation. Question 15. The golden hour for acute ischemic stroke refers to the window for: option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. Question 16. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A. EtCO2 of 0 mmHg. Option B. Persistent EtCO2 waveform with each ventilation. Option C. PtCO2 of 50 mmHg. Option D. A flat line waveform. The correct answer is option B. Persistent EtCO2 waveform with each ventilation. Question 17. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Question 18. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate: option A. No tetanus prophylaxis needed. Option B. A tetanus immunoglobulin only. Option C. Tdap or TD booster. Option D. A tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. Tdap or TD booster. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Le-Fort fractures are classifications of fractures of the: option A. Mandible. Option B. Mid-face and maxilla. Option C. Orbit. Option D. Nasal bones. The correct answer is option B. Mid-face and maxilla. Question 20. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: option A. TSI level 1. Option B. TSI level 2. Option C. TSI level 3. Option D. TSI level 4. The correct answer is option A. ESI level 1. Question 21. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of: option A. Acute glaucoma. Option B. Retinal detachment. Option C. Corneal abrasion. Option D. Cataract. The correct answer is option B. Retinal detachment. Question 22. In distributive shock, the primary pathophysiology is Option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 23. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 24. The most critical treatment for a patient with heat stroke is Option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C, the administration of antipyretics. Option D, active external revarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 25. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output.